Some of you probably remembered back in May I gave a pretty impassionate speech to the floor regarding masking and the issue in our schools. And I believe that the point is very important now, going to the fall, than it ever has been, even back in May. You know, I have a first grade son and a little girl who's starting preschool this fall here, really very soon. Now, I've inquired with the IDPH on multiple occasions and essentially have not received the information that I've asked for as a legislator, and this is really quite appalling to me. And if we actually look at what's going on around the world, we look at Britain, we look at the UK, we look at other countries and the way they're handling the mitigation standards and the way they're handling masking, they're not requiring universal masking. They're not requiring face coverings for our kids to be stifled intellectually, not be able to see faces or smile. They're allowing children that opportunity to learn in an environment that's conducive to preventing COVID-19. They're allowing children to do what's best and what's right. Folks, there's stories all throughout this country and frankly the world. You know, there's a story, and it's actually in the New York Times by Dana Goldstein. And I quote, "The UK has always from the beginning emphasized they do not see a place for face coverings for children if it's avoidable," said Dr. Shamiz Lahidi, a pediatric infectious disease specialist at St. George Hospital in London. This is very important. "The potential harms exceed the potential benefits," he said, "because seeing faces is important for the social development and interaction between people." Now, my district, all throughout your districts, I get calls constantly from every one of your districts asking, "Adam, what's happening? What can we do? Our kids, we care about our kids." And we have a universal mask mandate that's been pushed down by a totalitarian governor outside of his authority with the bureaucratic arm strong-arming our school districts through the Illinois State Board of Education, who is outside of their purview. And we all know it, folks. We all know it. The information that I do have shows a 0.004 hospitalization rate for children under the age of 18. Yet these mitigation standards go far beyond what we should be doing. And lastly, I get calls constantly about the vaccination mandates. And there's something that's very important, that this is about choice, it's about freedom. It's about an individual making the decision with their doctor and doing what's right, not government edict. That's very important. And there's one last act that I'd like to read to you. It's the Healthcare Right of Conscience Act, and it reads, "Discrimination," this is Section 5, "It shall be unlawful for any person, public, private institution, or public official to discriminate against any person in any manner because of such person's conscientious refusal to receive health care services contrary to his or her conscience." Black and white, folks, black and white. If we fail to take up action reining in the tyrannical governor for the last 18 months, we're complicit in these actions. Folks, it's time we do what's right for our kids. Thank you.